Hey everyone, welcome back to the channel. Today we're going to break down a super important class of drugs called calcium channel blockers, or CCBs for short. You might know some of the names like Nifedipine, Amlodipine, or Verapamil. Let's dive in and see how they work. How they work. Mechanism of action. Think of your arteries as a hose. When the muscles in the walls of the arteries contract, the hose gets narrower, and the pressure of the water, your blood, inside goes up. This is what happens when you have high blood pressure. Now, what causes these muscles to contract? A key player is a mineral called calcium. Your body has tiny calcium channels on the walls of your arteries. When calcium ions flow through these channels and into the muscle cells, it tells them to squeeze. CCBs are like a gatekeeper for these channels. They block the calcium channels on the walls of the arteries. Because the calcium ions can't get in, the muscles can't contract. So they relax and the arteries get wider. This widening of the blood vessels is called peripheral vasodilation. By widening the arteries, CCBs create more space for blood to flow, which decreases blood pressure. It's that simple. What they're used for. Indications. Because they lower blood pressure and relax blood vessels, CCBs are used for a few different conditions. Hypertension, high blood pressure. This is their primary use. Angina pectoris. This is chest pain from a lack of blood flow to the heart. CCBs help by widening the coronary arteries that supply the heart, increasing blood flow and oxygen. Peripheral vascular disease, a condition where narrowed blood vessels reduce blood flow to the limbs. Migraine. Some CCBs can help prevent migraines by affecting the blood vessels in the brain. When to be careful. Contraindications and precautions. It's crucial to know that CCBs aren't for everyone. Contraindications are conditions where you absolutely should not take the drug. These include hypersensitivity, if you're allergic to the drug. Hypotension. Since CCBs lower blood pressure, taking them when your pressure is already too low can be dangerous. Acute myocardial infarction, MI. A heart attack. Heart failure. In some cases, CCBs can worsen this condition. Precautions are situations where a doctor needs to be extra cautious and might adjust the dose. These include patients with poor cardiac reserve or severe aortic stenosis, heart conditions, diabetes or porphyria, renal and hepatic impairments, kidney and liver issues, pregnancy and lactation, side effects or adverse drug reactions. Like all medications, CCBs can have side effects. The most common ones are peripheral edema, swelling, especially in the ankles because of the blood vessel dilation, hypotension, dizziness or lightheadedness from a drop in blood pressure, palpitation, headache, dizziness, flushing, lethargy. These are also related to changes in blood pressure and flow. Gum hyperplasia, an overgrowth of the gums, less common but notable. Skin rashes. Doses and brand names, tags. Finally, here's a quick look at some common CCBs and their typical info. Nifedipine, a dose of 5 to 20 milligrams, taken 2 to 3 times a day. BD/TDS. It comes as a tablet or capsule for oral use. A common brand name is Dipin. Amlodipine, a dose of 5 to 10 milligrams, usually once a day, OD. It's a tablet for oral use. A popular brand is Amlod. Verapamil, a dose of 40 to 160 milligrams, 3 times a day, TDS. It comes as a tablet for oral use, but an injectable form is also available for IV use. Remember, this is just for educational purposes. Always consult your doctor or pharmacist before taking any medication.